Good afternoon, everybody. My name is Eric Depew, and it's my pleasure to introduce Laura Conrad, President, CEO, and General all-around nutritionist specialist for obese children. And she's going to do a presentation this afternoon to help you understand how she has a systematic approach to helping young kids. Laura is dynamic, as you will soon realize, and passionate about what she does. We are going to do a little housekeeping here for 30 seconds just so that you have the logistics down of how to ask questions. When you logged on, there's a chat box on the right-hand side, and you'll see down at the bottom it's got a place for questions. If you would, just type in your questions as they come to you, and we'll take care of those during the presentation if we're at the right spot or at the end. If we don't get to them all with all the folks that we'll have today on the line, then we'll definitely get back to you, Laura, or one of her folks will. As you will see, this is a solution to a widespread problem that we have, and it can be applied either corporately or personally. And with that, Laura, I'm going to let you go ahead and get started, and we're going to try to honor their time. But if you do have questions, please feel free to type them in for us, and we'll take care of them for you. Laura?
Well, thank you, and good afternoon, everybody. It's still a late morning here in California. We are excited to have all of you join us for the sole purpose of finding new resources and effective resources for families, children, and parents to start eating healthier and moving more on a daily basis. Too often, we are left with restricted geographic locations, and having the MyShapers program online is really breaking that ceiling, that glass ceiling, and it's blowing open the opportunity for everybody. Zip codes no longer are going to be determining whether or not their zip codes no longer going to be determining the effectiveness or the resources and accessibility to having a healthy program online. I'm Laura Conrad. I have taught thousands and thousands of people throughout the Northern California, 30 Kaiser hospitals and HealthNet and multiple public health and employer group settings. And my mother is the original founder of Shapers. Dr. Farshad Fani Marbasi is our Chief Medical Officer, and he is an expert in nutrition as well. We are excited today to bring to you the opportunity to learn more about the industry and a solution. We all know that there's a problem with obesity and children being overweight along with adults. Now we're at 17%, just shy of 17% of American children who are obese, and about 30% of them are actually overweight. Now, we know that the statistics for adult obesity is astronomical, and so many of these adults weren't even overweight as children. So we see the writing on the wall. We know that 80% of children with obesity will be obese at age, excuse me, let me just say it again. 80% of children with obesity will be 25-year-old adults with obesity. 80%, that is astronomical. We need to be able to intervene early on in order to be able to reverse these statistics that are happening. Health consequences, the lists are incredible. 40 different diseases or ailments associated with obesity. We know the statistics. They are catastrophic, personally and in the healthcare and employer group setting. This is a loss of production, productivity, and high costs. Why do families need better health education access? Our habits immediately impact our health. When we have to wait 2 months, when we have a motivated person now, it is discouraging. It can take the edge off of the enthusiasm, and even worse yet, they're not getting the results they can while they're waiting 2 months for a class to start. So the traditional approach to health education is you go to a location once there's enough to sign up for that class, and then you have to go there week after week. And we know that zip codes determine whether or not there's access. We know that the transportation issues, family dynamics, such as maybe we have a single parent and they have more children at home and they can't leave them at home. They need to be there. So access to health education is very limited, whereas having a complete program online is abolishing those standards that are very limiting. We now can create a comprehensive, or we have created and create this access by you providing this out to your employees and staff. So unhealthy habits are learned, and healthy habits can be learned as well. I think of the nurse in Kaiser Oakland who was insulin dependent, and teaching her on our Wednesday night classes, within 2 weeks, she was off of insulin. So we are able to immediately affect your change in energy level. Fast foods, sedentary lifestyles, busy lifestyles, and even dieting have all contributed to poorer health. And yeah, dieting, because we get on a diet to stop one. We focus on how we look rather than how we feel. When we're on a diet, we think about weight loss rather than behavior change. And when we change the focus to results rather than the habit, we end up having a temporary change, and we find it difficult to sustain. So when we are focused on healthier habits, that is a continued behavior throughout our life. The third point here is why families need better access to health education is having children and parents learn healthier eating and activity habits together creates a supportive environment for the family. So the child and the parent log on and watch the videos and interact and do the home activities together. According to the Robert Wood Johnson Foundation, research shows that a positive educational experiences early in a child's life can affect his or her future health and well-being. That is key to being able to ward off excess body fat, which creates the obesity, which creates many of the diseases that we need to prevent, and the energy level and productivity and just how we feel, our self-esteem. So early intervention is key. The child and the parent together support one another, much like in the tobacco way back when we're trying to get the parents to stop smoking, telling them it causes cancer and heart disease and lung cancer, didn't change the behavior like it did when we started educating the children. When we told the children what tobacco does, they would come home and talk to mom and dad about it, and our chief medical officer's own father stopped smoking when Dr. Shaw was a toddler, because he ran outside and ran through dad's smoke and started coughing. So that convicted his father that he can't do this and put his son at risk like this. When a child is able to work with the parent together in eating and healthier habits, we find that that supportive environment is a key differential. So how do you approach well-being? We approach it as a whole family. It doesn't matter if you're underweight, average weight, or overweight, because everybody needs to eat healthier and move more. And we know that when we identify the overweight child in the family and or overweight adult, that person or people are particularly isolated from the rest of the family's eating behaviors and activities. So we would rather engage everybody in the family to getting more broccoli in and eating more leafy greens and whole grains and lean meats and walking more and moving more and supporting the positive behavior, rather than one person needs to eat this way and everybody else eats that way. It's the typical way a weight management industry sets someone up to fail, so they keep coming back. The second point we have here as to how to approach well-being is everybody needs to learn positive nutrition and activity management techniques and education. And we teach techniques how to be a better manager, not a better dieter. And this is where we help them avoid extremes. Diets need to be avoided whenever possible because they're dangerous. And I kind of chuckle because that's what always we think of. We go on a diet to lose weight. And it sounds like I may be contradicting myself by saying, what? Don't worry about dieting? No, our diet matters, but dieting is a short-term approach to a long-term challenge. So they need to be avoided, diet, so we can, again, avoid the extremes. Focusing on finding a balance by becoming a better manager, not a better dieter, is the key to a long-term success. And we help people through a technique called do something as something. Do something here, something there, something here and there. In other words, parking further out in parking lots, taking the stairs instead of escalator, walking more briskly from point A to point B in order to burn more calories at every opportunity throughout the day. Because we don't always have another hour in the day to go to the gym or to get out there and go for a nice walk. We need to get those times in. But if we can start interjecting more fitness throughout the day, we have increased our metabolic activity and decreased our risk of diseases. Likewise in nutrition. When we become a better manager, not a better dieter, we use this SOS technique and doing something of something, getting a little more broccoli in, cutting out a little of these solid fats, increasing better proteins. These small choices end up putting a person into a high self-esteem, putting people into action consistently. Action equals results. So let me show you a demo of what our website does. They will log on, your employer, your employees, your employer groups, healthcare groups, clinics, schools, easy to use. They come to the website, they immediately log in, and they're ready to go. The curriculum is done. So the curriculum is listed here, the course content. We have 6 lessons with 46 videos. So we are providing a year access. We've just changed it from 8 weeks to 1 year access so that everyone is able to go through the videos as often as they like. So here's lesson 1, series of topics. And here's a navigating course on the right as well. Lesson 2, lesson 3. And if you click on it, it then opens up and shows you the rest of the videos. We have videos and then a quiz. So the parent and the child watch together. Let me go ahead and show you a quick little video here on let's find healthy foods at the store. So I have a fun, enthusiastic, energetic personality to help the kids engage and help them realize that this is important and valuable. So we're showing them how to shop healthier, eat healthier, move more. And then when they're done with the quiz, they will actually click, the video, they will click on the quiz and they'll decide, what are 2 healthy snack choices? And they'll click on it. It's interactive. The kids like to do this, and then they'll check their quiz. So I clicked on things that I thought were healthy, and it says, yes, it was right. So the kids continue through the little quizzes, and then we go back to the videos. The charts, we have a registered dietitian in this as well. So we have charts that are printable, they are interactive, and these will allow the families to start eating healthier consistently and reinforce the positive habits. This is an example of a printable for them to put up on their refrigerator, to keep it in their car, or take it with them grocery shopping. So the simplest way to provide an evidence-based nutrition program is by offering the MyShapers program as a resource for your members, employees, and healthcare groups. Our program has these 4 components each and every lesson. We teach self-management so that the families engage in home activities. The next component each week we teach is behavior modification, so they can have a whole lifestyle improvement. The family, not just an individual in the family. The nutrition education is the 3rd component, and it's inspiring families through education. It's not enough to say, eat this or that. We inspire the families by helping them understand the impact of what that choice does to their body. And it really builds the self-esteem up because the families start associating success with what they're doing. In fact, we have results that show 88% of the children 6 to 12 months post-intervention have higher self-esteem. And of those who started with low self-esteem, almost 92% have higher self-esteem. That's phenomenal results. It means that they feel good about what they're doing. And that's what health is, feeling good. It's not enough to be thin, but you've got to have energy. You've got to lower your risk of disease, and you need to feel good about what you're doing. Okay? So the last component is about moving well, managing physical activity for optimal health. And we've hinted at that. We've got to move our bodies every single day. And when we do it, it increases our energy, whether it's at home, whether it's out at a lunch break or at school. We want the children to be more active at their lunch breaks and before and after school. And we want the parents to make it a priority to do activities together. So a parent note will actually say, I will exercise with my child, and it has a blank, this many times this week. And so the parent, as a manager, will choose as a home activity how many times they're going to exercise with their child that week, and they set up a goal. Key partners who are currently offering the MyShapers program are the nonprofit organization Improving Diabetes and Obesity. It's a perfect fit because the nonprofit is committed to helping reverse and help change obesity. We are a key resource for them throughout the entire state of Nevada. So at first it was just in Southern Nevada, but because we had such a huge response, we're now throughout all of Nevada with them. The United Latino community in Carson City, Nevada, the program director of diabetes and coordinator for partnership, Kathleen Meidel, is offering our program now to the families there as an additional resource. It's another tool in the bag for her to help the families learn how to eat healthier. So while they may be signing up for a class, they can immediately start learning more, and they'll be a more educated participant in any future classes that they do join in. So while someone may be waiting for a class, this is a great resource to start learning right away. Catch them while they're motivated. The Children's Heart Center in Nevada is the 5th largest pediatric cardiology hospital, has 5 locations throughout Nevada, and we are being offered at all 5 of their locations. We are now in the Visions in Education School District. They are a charter school, and the families are signing up for this as curriculum. And the National Alliance Healthcare Purchaser Coalition, Mike Thompson, the president and CEO, and I, with the MyShapers program, are working together and rolling this out through his 50 coalitions that represent 45 million lives. So we are HIPAA compliant. We work within your mission and your vision and your current actionable plans that you're doing. We help support those and provided any additional resources that you may like. And we do an assessment with what you're currently doing for us to be able to see if the fit is good, what we need to do to lift off, and can provide you additional resources through our clinical and technical team as well. So the program is entirely online. We get the question, is there a teacher, or is it? We know that teleconference programs may, if you're familiar with them, may seem simple, but you're still left, when you're offering it, to have to find a conference room, have enough people to register, and all of the similar challenges of people waiting for a class to start, if you get enough, and all of the materials management and quality control issues of having a program offered at the standard you expect. So our program eliminates many of the risky variables because the quality control is built in. The program's done. So each location, you have a similar experience, exact same experience. It's not contingent upon the quality of the instructor or ease of access to the location or time. It's totally online. It's an engaging platform. As I showed you a demo, they'll watch a video, they'll click on some quizzes, because we need to make sure that they're comprehending what they're learning. The program is easy access. They click on it, they sign up, it's done. The beauty of the online is it is literally 24 hours a day, 7 days a week, 365 days a year, unprecedented access. And we're so excited about that. We're really proud and passionate about bringing this to the masses. And this is allowing you to bring this to your groups. One of the key points that we like to make is that the families need to have fun together. It's a positive approach. we're helping them catch themselves doing something right. Too often in weight management, it is catching you doing something wrong. And if any of you are in the weight management industry, and you know when you ask one of your patients, how was your week? How was your last month? How was your eating habits? The first thing they say is what is not good. That's the way we've been trained. So what we want, and we're helping to retrain our thinking, is to start catching ourselves doing something right. What are we doing? No longer will we set up a patient or a member, an employee, for failure by suggesting a restrictive diet that they have to try to adhere to try to get some results. So they're going to eat a piece of broccoli, run around the block, and feel better. A diet says, eat a piece of broccoli, run around the block, and stand on the scale to see if it made a difference. And that is the thing that stops people from succeeding, because it's not going to reflect your positive habits you just did, lowering your risk of diseases. It's not going to show on that scale. The scale is one indicator of your health, not the sole indicator. So positive approach, catching yourself doing something right, focusing on what you are doing. And again, the quality control by having it completely online is a key differential. The program is phenomenal as far as affordability as well. It's, I genuinely mean it. It's pennies on the dollar. Typically, you take a program, you roll this out, it's $5 to $7 per month per employee. This is less than 50 cents per employee per month for an entire year. You heard that correctly. I've had people say, well, something's wrong with that pricing. That's not right. I'm like, well, I can charge you more if you like. No, the idea is it is right. The program is complete in and of itself. We don't have the labor-intensive cost built into it. That's why we're able to offer this for literally pennies on the dollar. Again, thank you for joining us today. This is the MyShapers.com online better eating and better activity program for children and parents. I see that we are close here on time. I would like to answer the few questions that we have right here. If you don't mind, I'll take those offline. I will send you an email, and I can set up a time where we can talk, and let's go from there. Thank you again for joining us today. And again, I'm Laura Conrad, the President and CEO of MyShapers. Please feel free to call me at 916-390-2513 and or email me at laura@myshapers.com. Thank you so much and have a fantastic day.